Welcome to this masterclass on community health nursing, where we will cover the types of prevention, a frequently asked topic in nursing exams like NORCET, RRB, ESIC, and DHS. As Swami Vivekananda said, success is the result of preparation, hard work, and learning from failure. Let's start with high energy. Every step brings you closer to your dream nursing job. Today, we will cover the basic concepts of prevention, the 4 levels, primordial, primary, secondary, and tertiary, in detail, and conclude with exam-focused questions and quick revisions. Prevention involves actions to minimize the impact of disease and disability. The concept has evolved from individual care to community wellness. Success relies on understanding the natural history of disease. We relate prevention levels to the disease phase. Primordial and primary occur in the pre-pathogenesis phase, aiming to prevent disease occurrence. Secondary and tertiary occur during the pathogenesis phase. Primordial prevention is the newest level. It prevents the emergence of risk factors themselves, typically targeting the whole population, especially children, through lifestyle and behavioral changes. A classic exam question asks, discouraging children from adopting harmful lifestyles like smoking is which level of prevention? The answer is primordial prevention. Primary prevention is action taken prior to the onset of disease in the pre-pathogenesis phase. It has 2 main modalities, health promotion and specific protection. Health promotion includes general actions like health education and nutritional interventions. Specific protection involves targeted efforts like immunization, chemoprophylaxis, and protection against occupational hazards. From a NORCET previous year paper, the question is, which of the following is an example of specific protection? The correct answer is B, immunization. Chemoprophylaxis is the administration of drugs to prevent infection. High-yield examples for exams include rifampicin for meningococcal meningitis and penicillin G for rheumatic fever. Vitamin A prophylaxis for a child is an example of primary prevention, falling under specific protection, as it proactively protects against blindness. Secondary prevention halts disease progress at its incipient stage during the early pathogenesis phase. The main intervention is early diagnosis and treatment, with screening as the primary tool. Screening tests are key in secondary prevention. Examples include Pap smear for cervical cancer, sputum exam for tuberculosis, and VDRL for syphilis screening. Self-examinations are also secondary prevention. According to this RRB previous year question, a school health nurse conducting a screening for pediculosis is performing secondary prevention, as screening identifies existing cases early. Tertiary prevention is applied when the disease is advanced. Its modes of intervention are disability limitation, which prevents further damage, and rehabilitation, which restores function. Rehabilitation modalities include medical, like physiotherapy, vocational, for restoring capacity to earn, social, for family relationships, and psychological, for restoring confidence and self-esteem. Providing a hearing aid to a patient with deafness is an example of tertiary prevention, specifically rehabilitation, as it restores the ability to communicate. This table summarizes the levels at a glance. Primordial and primary have an absent disease, secondary is early disease, and tertiary is late disease. Keywords are lifestyle, immunization, screening, and rehabilitation. A critical distinction. Primordial prevents the appearance of risk factors, while primary prevents the disease in people who already have the risk factors present. The role of the nurse spans all levels, as an educator for primary prevention, a screener for secondary prevention, a provider of vaccines, and an advocate for tertiary rehabilitation services. Disability limitation is a mode of intervention associated with tertiary prevention, applied when the disease has advanced. Prevention in the workplace, such as using earmuffs against noise, respirators against dust, or lead aprons against radiation, are all forms of primary prevention, specifically specific protection. A community nurse giving DOTS therapy to a tuberculosis patient is performing secondary prevention, as this is early treatment for an existing disease. Prevention is vital because it reduces overall morbidity, lowers infant mortality, is cost-effective compared to treatment, and increases life expectancy. Post-exposure prophylaxis for rabies is an example of primary prevention, falling under specific protection. Nutritional prevention like vitamin A supplementation and using iodized salt in the National Goiter Control Program are examples of primary prevention, specifically specific protection. A person undergoing speech therapy after a stroke is an example of tertiary prevention, which focuses on rehabilitation and restoring function. Environmental prevention, such as ensuring a safe water supply and proper excreta disposal, are forms of primary prevention. Swachh Bharat Abhiyan is a massive primary prevention campaign. For non-communicable diseases, actions range from primordial/primary for obesity control to secondary for early detection and tertiary, like preventing heart failure in a hypertensive patient. The question is, which of the following is not a modality of primary prevention? The answer would be a form of secondary or tertiary prevention, such as screening or rehabilitation. Sputum microscopy for a patient with a persistent cough is secondary prevention, as it involves early diagnosis of an existing condition. To master this topic, read the question stem carefully, identify keywords like screening or rehab, and practice solving multiple-choice questions daily. Good screening tools, central to secondary prevention, must possess high sensitivity, the ability to correctly identify those with the disease, and high specificity, the ability to correctly identify those without it. Genetic counseling for a couple with a family history of thalassemia is considered primary prevention, classified under health promotion. This rapid revision summary provides a final overview of the 4 levels, the state of the risk factor and disease, and the essential keywords for each level. Remember that consistency is key to cracking NORCET and RRB. Your hard work in preparing for these exams will pay off. Join our learning community. For PDF notes and daily MCQs, message "levels" or reach out via the provided contact information. Thank you for watching this video. Wishing you a bright nursing career. This video utilized several image resources to illustrate the concepts discussed. These images are sourced from various publicly available health and educational platforms. More images used throughout the video are listed here, providing proper attribution to their respective sources.